Last week, a woman took her children to the hospital because they had high fever. While waiting for her children's test results, she decided to do a general checkup for herself. She checked her vital signs, checked for kidney function, liver function, urine analysis, urine MCS, amongst others. Once in a while it is good to do a general body checkup. After 3 days, one of her test results indicated she has moderate growth of Staphylococcus aureus, but she had no symptoms. Staphylococcus sometimes present with no symptoms. What is Staphylococcus aureus? This is what Staphylococcus aureus looks like. Earning a reputation as a formidable foe, Staphylococcus aureus, or staph for short, is a type of bacteria that has been wreaking havoc on human health for centuries. From skin infections to life-threatening diseases, staph has become a household name synonymous with danger. But how much do we really know about this stealthy microbe? Staphylococcus aureus infection is not a sexually transmitted infection, but if it's on the skin it can be passed across. Unless there is direct contact with the affected area, if not, hugging and kissing doesn't pose a great risk for transmission. Staph is commonly found on the skin and nose of healthy people. Staphylococcus bacteria can lead to a range of illnesses in both humans and animals, either by producing toxins or by invading and penetrating tissues. Food poisoning is often caused by toxins produced by Staphylococcus bacteria, which can grow and multiply in food that has not been stored properly. Cooking can kill staph, but it does not destroy toxin if already produced on the food. Staphylococcus exist harmlessly on our skin and mucous membranes because they act as barrier against staph. Staphylococcus becomes harmful if it finds its way into the body through cuts on the skin, scrape, wound, or food ingestion or by inhalation. Staphylococcus infections are usually treated with antibiotics. Anyone can get staph, regardless of age or health status. In fact, staph is a common cause of skin infections in healthy individuals. Skin infections like pimple, boil, cellulitis, itchy skin. Staph is a major contributor in infection-induced infertility. Staphylococcus in and around the vagina may result in abnormal discharging or itching. Staph is primarily spread through skin-to-skin contact. By touching someone who has a staph infection, especially if they have an open wound or cut. And by touching contaminated surfaces. Surfaces or objects that have come into contact with staph, such as door handles, light switches, remote controls, gym equipment, a wound or cut that's not properly covered. Sharing personal items that may have come into contact with staph, such as towels, razors, makeup or makeup brushes, hair clippers, contaminated implanted medical devices and improperly cleaned needles, like those used for tattoos and injecting drugs. Staph infection can also be spread by airborne transmission, inhaling staph bacteria that are released into the air when an infected person coughs or sneezes. Poor hygiene, not practicing good hygiene, such as not washing hands regularly, not showering or bathing regularly, not cleaning and disinfecting surfaces regularly. Contaminated food and water, consuming food or water that has been contaminated with staph. Such contaminated food can cause food poisoning. Medical procedures. Staph can spread through medical procedures, such as surgery, injections, blood transfusions. Close living quarters. Living in close quarters with someone who has a staph infection, such as family members, roommates, athletes sharing locker rooms. So basically, staph spread by touching someone who has it. Touching contaminated surfaces or objects. Sharing personal items. By inhalation. So how can one tell if one is infected? Some staph infections, like methicillin-resistant Staphylococcus aureus, may not always show symptoms immediately. However, here are the common signs and symptoms of Staphylococcus infections. On the skin, you can see the following. redness, swelling, and warmth around the affected area, purse-filled bumps or abscesses, crusting or scabbing, pain or tenderness, increased sensitivity. In respiratory infections, there is coughing or wheezing, shortness of breath or difficulty breathing, chest pain or discomfort, fever and chills, fatigue or weakness. In bloodstream infections, there is fever and chills, rapid heartbeat, low blood pressure, confusion or disorientation, nausea and vomiting. In general, other symptoms include headache, muscle or joint pain, swollen lymph nodes, rash or hives, diarrhea or abdominal pain in some cases. Severe symptoms: high fever over 39 degrees Celsius, that is over 103 degrees Fahrenheit, severe pain or swelling, difficulty breathing, confusion or loss of consciousness, severe headache or stiff neck. Staphylococcus urinary tract infection presents with fever, sometimes there's blood in urine, pain when urinating, suprapubic pain. If you experience any of these symptoms, seek medical attention promptly. Not every fever or symptoms is malaria, typhoid. Early treatment can help prevent complications and improve outcome. Staph can cause serious infections if it gets into the blood and can lead to blood poisoning or death. Staphylococcus can affect the function of internal organs. If left untreated, can cause kidney injury. It can impair sperm function negatively, especially sperm quality, sperm movement, and its form and structure. If you've been exposed to staph and have a weakened immune system, like the elderly and those with chronic illnesses, consult a healthcare professional for guidance. Remember, staph can spread easily, so it's essential to practice good hygiene, washing hands frequently and regularly with soap under running water, treating and covering wounds properly, and take precautions to prevent transmission. Especially because some staph bacteria are difficult to treat, because they are resistant to common antibiotics. Together, we can combat this formidable foe and save lives. If you like this video, please like, share, and follow for more infotainment.